Good morning, everybody. Okay, good morning, Queensland, and good morning, Gold Coast. It's wonderful to be here at Coomera, and shortly we'll be talking about another brand new school that we've built in time for the school year, and this time it's the Coomera Special School. And I'm really delighted to be here today. Another great investment by our government, catering for the growth in these growing communities. So we've got a few things to get through today, so we'll try and do them as efficiently as possible. But the first thing we need to do is the COVID update. We'll talk about the school. Dr. Gerard will also talk to you about a study that has been done on the Gold Coast that he wants to share with you. He'll give some oversights, but he's available to stay after the press conference and go into a bit more detail if anyone has further questions about that. So first of all, we have 8,643 new cases, including 3,348 positive rats. Tragically, it's my sad duty to report that overnight we have had 9 people pass away. 4 of those people were in aged care, and Dr. Gerard will go through. They were all over 60, but any loss of life is a tragedy, and there'll be families out there grieving today and tonight. And I just want to pass on our condolences to the people who have lost their lives. We have 749 people in public hospitals and 47 in ICU, and 19,818 tests in the past 24 hours. 92.07% at least have had one dose in Queensland, 89.71 a second dose. Our boosters are now at 57.5% of our eligible population, 1.483. And our 5 to 11-year-olds, and once again, if I can do a big shout out to please go and get your children vaccinated. School is starting on Monday. We have 35.94% of our 5 to 11-year-olds that have had one dose. I would like to see that up a bit more, so please give that consideration if you can. Now, before handing over to Dr. Gerard, he has conducted a survey, the first of its kind in Australia. It was raised at National Cabinet, and I think other states will now follow. It was random sampling of people on the Gold Coast just to see how prevalent the virus is in the community. And the results are quite interesting because it actually shows that some people who were tested randomly were actually positive, and they didn't know that they were positive. So it does show that the vaccine and the boosters are helping, but it does show that the virus is out there. So I'll hand over to Dr. Gerard, but there were 2 studies done, one on the 22nd of January and one on the 29th of January, and it does give us a good understanding about testing to see that rate of positivity in the community, how many other people may have been positive, and whether or not those results are coming down to show that the wave on the Gold Coast is actually coming down, which is true. So I'll hand over to Dr. Gerard. Thanks.
So thank you very much, Premier. We have 9 deaths to report today. That is 9 people who've died with a recently positive COVID-19 test. 1 person in their 60s, 2 in their 70s, 3 in their 80s, 1 in their 90s, and 2 people aged over 100. Of these 9 people, 3 were unvaccinated, 1 had received a single dose of vaccine, 4 had received 2 doses of vaccine, and only 1 of the 9 had received a booster. Our thoughts again are with their families. In our public hospital system, we have 749 being treated in hospital with COVID-19. That continues the downward trend. It was 763 yesterday. This includes 46 people in intensive care, 23 of whom are ventilated, and that's again down from 49 on Wednesday. In our private hospitals, we had 71 patients being treated for COVID-19, down from 74 on Wednesday. So as the Premier has mentioned, the Gold Coast has been at the site of an important survey conducted by the Gold Coast Public Health Unit to get a better idea of what is really happening with COVID-19 here in Queensland and Australia, and it's the first time that anyone has attempted to do this in this country. There were effectively 2 studies done on consecutive Saturdays. The first was done 12 days ago, and the second just on this last Saturday past, where addresses of Gold Coast residents were randomised using a computer, and then staff from the Gold Coast public health units, in collaboration with the universities here on the Gold Coast, Griffith, Bond and Southern Cross universities, including students as well, knocked on the doors of people and asked them if they could be tested. And we're very, very happy that so many people agreed to be tested. That was incredibly helpful in trying to understand better what's happening with this virus in Australia. So on the 22nd of January, that's not this last Saturday, the Saturday before, when we believe the virus was peaking on the virus pandemic was peaking here on the Gold Coast, 117 households were visited, randomised households were visited, and tests performed on an individual within that household. So of those 117 households, of the 117 people tested in 117 randomised households, 20 came back positive. That's 1 in 6 people on that one day. Well, that one day, the 22nd of January, 1 in 6 people were positive on a PCR test collected at their homes. Now, of those 20 people, only 4 of the 20 who tested positive reported having any symptoms. Only 4 of the 20. So 4 out of 5 people who tested positive did not report having any symptoms on that particular occasion. So there are people on that day on the Gold Coast, 1 in 6 people walking around the Gold Coast, if this is generalisable, and it's a moderate-sized sample. It's not a huge sample, but it's a moderate-sized sample. There were people walking around the Gold Coast who had no idea that they had COVID-19. A substantial number of those people that were infected had no idea, hence the importance of masks, even when you feel well. Now, people were also tested who knew they were positive. So there were 2 among the 20, 2 among those 20 who already knew they were positive because they had symptoms and had gone and got tested. So, but that means that of the 20 who tested positive, only 18 were aware. Sorry, I'll say that again. Of the 20 who tested positive, only 2 were aware that they were positive. So 18 out of 20, or 9 out of 10, were completely unaware that they were positive. 9 out of 10 people. So I'll say that again. 4 out of 5 had no symptoms, and 9 out of 10 were unaware they were positive. So this is quite extraordinary, and that was probably at the peak of the pandemic. That's when we calculate the peak of the pandemic to have been. The whole procedure was then repeated 7 days later. That's this Saturday just passed. And this time we had 143 households were visited. And so 143 randomised people in different households on the Gold Coast were tested. And 11 tested positive on this occasion. 11 tested positive. And of those 11, this time 6 of the 11 reported having symptoms. 6 of the 11 reported having symptoms. So that's a little bit different to the first time. But I can't recall the number that actually had, Oh, that's right, 2 of those 11. 2 of those 11 were aware that they were positive. 2 of those 11 were aware they were positive. So 9 out of 11 on this second survey did not know they were positive. So this shows a couple of things. First of all, it indicates that the pandemic peak has passed here on the Gold Coast, but also a lot of people that have been infected are completely unaware that they are infected and certainly have not been tested. They either have no symptoms or they have not been tested, and the number is quite significant. So this feeds into data that will be collected nationally to try and work out where we are going with this pandemic. So We're trying to work out what proportion of the population has actually been infected, and what degree of immunity that has created in the community, and what will happen in the future in terms of whether there will be further waves in the community. So at this stage, we still don't know exactly the total number of people on the Gold Coast and in Queensland that have been infected with the virus, but it's likely to be at least a third of the population of Queensland infected by the end of this month, we believe, at least. But there will be further work done, and further statistics and work done on this in the coming weeks, both locally and nationally on this. And what impact this has on predicting what is going to happen going forward, that's yet again to be worked out. We are still planning for further waves of the pandemic. I think we still have to plan for the worst, that there are likely to be further waves of the pandemic. We are particularly concerned about winter. We're not going to have the opportunity of seeing what's happening in the Northern Hemisphere in advance as further waves might occur, because the Southern Hemisphere will enter winter first, before the Northern Hemisphere enters winter after this Omicron wave. So exactly what will happen here, it is still difficult to predict. We're still planning for a further wave in winter, but clearly the virus is much more widespread than the collected data has suggested. I'll now hand over to the Minister. Thank you.
Thank you, Dr. Gerard, and can I also pass on my thoughts and condolences to the family of those who have passed from COVID in the last 24 hours. The surveillance work that we're talking about, the random surveillance, this is 260 households over a 7-day period, over 2 weekends, that no other state or territory has done. We've all looked at our modelling based on our number of tests that have been done, both rapid antigen tests and PCR, and our hospitalisation rates. But now we can have a much better understanding of what is the prevalence of COVID in our community. And this study showed that as we were getting into our peak, 1 in 6 people on the Gold Coast was showing up positive through this sample, and now we're looking at 1 in 13. Now that's great that we're seeing a decline, but 1 in 13 is still quite high. And of that second group assessed last Saturday, many of those people had symptoms but hadn't gone and got tested. So I will say to people, there is plenty of capacity now at our testing clinics. You can come forward and get a PCR test if you have symptoms, or come forward and get a rapid antigen test, or if you already have a rapid antigen test at home, take that test if you have any symptoms, no matter how mild, because what this shows is if you've got symptoms, you've more than likely got COVID, and it's best to know that. So I want to thank the Public Health Unit of the Gold Coast, the universities, the nursing graduates and students who participated in this study. It really has helped us get a better understanding, and it reinforces what we are seeing as far as the number of hospitalisations going down and the number of positive cases coming up in the testing going down. So really good work, really important work, and it shows that most of those people, only 2 people on each of those weekends had actually got a test and knew they were positive. All of the others were not aware that they were carrying COVID, and of course that means they could be passing it on to other people without being aware of that. I do want to touch on briefly, we had an incident overnight in a private health facility in which the Eden Private Hospital at Coomera, they had flooding and infrastructure damage, so they had to evacuate the private hospital last night. I want to put a big shout out to the Sunshine Coast University Hospital, to the local other private hospitals in the area, Queensland Ambulance Service, who worked so well together overnight to transfer all of the patients out. Some were able to be discharged, others were transferred to other facilities, and some to the Sunshine Coast facility. There were 31 patients in total that needed to be relocated or discharged overnight, and everyone did an incredible job to step in and address that. So I do want to give my thanks to everyone and continue to remind people to come and get vaccinated. As the Premier said, our 5 to 11-year-olds, we're still only at the 35% mark, and our 12 to 15-year-olds, we are still sitting at 67.76%. We need that number to come up, and we want to see that at a higher rate. And of course, we're slowly creeping towards that 90% double dose as well. And thank you to everyone who's getting their boosters. I've seen the announcement from Greg Hunt this morning saying that 16 and 17-year-olds can now get their booster. We will make sure our vaccination clinics, our public clinics, will be able to take 16 and 17-year-olds from today. So if your child is 16, 17, they're eligible for their booster, they will be able to get those at our vaccination centres that are already offering booster shots as well. So I welcome that announcement. The last thing I do want to say, though, is I have very briefly heard that it's been announced that the Commonwealth are going to establish a task force for aged care. We've had a Royal Commission. The recommendations are there. The Commonwealth knows what needs to be done, and they need to get on with implementing those recommendations. If this task force is about looking at COVID and urgently making sure there is a rapid team that can go around the state and support these aged care centres, that's fine. The more help they can give, the better, because these aged care facilities are really struggling right now. There is a shortage of staff. There is poor infection control that we're seeing in some of these facilities. There is extremely high rates of positive cases in residents in some of these facilities, and very high rates of positive cases across staff where they do not have adequate staff to properly look after the residents and proper infection control. Whenever we become aware of these, we are making sure we are letting the Commonwealth know at the highest level. But there needs to be better communication within their own government about these issues, so that not hearing it from us for the first time when these should be known by the Commonwealth. Their regulators should be aware of these, and there should be proper channels to escalate these situations before we get into dire situations with these residents. So I look forward to hearing what this announcement's all about, what the task force is supposed to be doing. But if this is a long-term task force to spend more money, the money is be better off put directly into aged care, making sure they've got adequate staffing numbers and making sure that they are meeting their compliance regulation to keep the residents safe. Thank you.
Any questions on COVID at all? Sorry?
There was a truck apparently that rolled in the
Oh, okay, we're not aware of that.
Yeah, it's just been reported.
Oh, okay.
Was it the one at Foster Tonkari, or was it?
All I know is
Yeah,
it's a
look,
very big truck.
we'll have a yeah. So hopefully, first of all, the driver's okay, but I'm quite sure the rat test will be all right. So we'll get them out to people as soon as possible. Okay, I want to talk briefly about the school that we're here to look at today. Then I'll take any questions, and then the Education Minister will then speak after me. So this is great that we're here for our third school that's opening this year, and this is a Coomera special school. And I know that the Principal, Kate, is very excited about welcoming students on day one on Monday. This is a $50 million investment. So we invest in schools. The LNP like to put a sheet out of closing schools, but we're investing in schools, and over $1 billion has been invested in new schools since we came to office. I'm very proud of our record in education. We had 150 construction jobs here, 34 apprentices. There'll be 168 students in stage one. And this area in particular is a growth area on the Gold Coast. The population in Coomera, Pimpama and Upper Coomera is projected to double over the next 2 decades, from 79,000 in 2021 to approximately 161,000 in 2041. So we know how important it is to cater for all of our students, including our children with a disability or with special needs. And Kate advised me that she even had 3 new enrolments that were received today on top of the number of people coming in here on Monday. So we wish all of our school students the very best. And like I said earlier on, if you can please make sure that your children are vaccinated before they go to school on Monday, that would be great. Now, I'm happy to take any questions, and then Minister Grace will talk more about education.
Premier, this morning on the 4BC Breakfast
Yep.
Show, Presenter Neil Green
Yes.
has aired some allegations that, again, are coming from Mike Summerall, This is in relation to David Barbagallo's resignation letter. The questions put to the Queensland Premier are this: did that letter ever exist? And what is Mike Summerall talking about when he was handed a letter to sign off on that had come from your office? And was that the original resignation letter?
My understanding is that these matters have been referred to the CCC, and nothing has come to me to take any further action on that.
You've never seen a letter. You've never seen a resignation letter from your former chief of staff.
You'll have to ask the CCC the status.
Have you ever seen the letter or not?
The status of the resignation letters don't go to me; they go to MSB for a start.
Did he say previously that he sent you a letter in resignation?
I'm just going to say this matter was referred to the CCC, Peter, so please ask the CCC. Tim Mander, I understand he may have made a complaint. He may also have a letter stating the outcome of that investigation. I don't know. You'll have to ask him.
When did Mr Barbagallo resign, and did you find at the timing of that resignation?
No,
When did you resign?
I don't have that information on me.
In terms of the public service,
Yes.
will you commit to giving them training about their responsibilities to give frank and fearless advice, whistleblower sections, and also reporting appropriate issues?
I mean, they know that as part of their code of conduct. That is part of the code of conduct that every public servant, when they come and work for the Queensland Government. As I said, and I say this again, I expect our public servants to provide frank and fearless advice. That is one of the great institutions of having a robust public service in this state. Now, unlike the LNP that sacked 14,000 people, and let's be very clear on that, people were tapped on the shoulder, people were crying in toilets, being told that they were to leave their jobs immediately. Now, that does not happen under my watch. We have restored those frontline services across the state. I will not be lectured by the LNP on accountability and transparency and integrity. When I was the leader of the opposition, I was booted out of Parliament Opposition Office by the LNP. I had to go and use an office that was next to the media gallery. We weren't given phones, we weren't given computers, and we had to wait until there was alternative accommodation provided for the opposition of the day. That was the hallmark of day one of what they did to an opposition in this state. So let me make it very clear. I uphold the robust institutions that we have in this state, and I respect those institutions. I don't cut funding to the CCC like the LNP did. We don't handpick a person to lead the CCC like the LNP did, and we don't sack the PCCC committee in the middle of the night. That is not the hallmarks of good government. Now, the people of Queensland 7 years ago had their say on this when they voted Campbell Newman and the LNP out.
Didn't the government strip resources to the Integrity Commissioner's
Sorry?
office? Didn't the government strip resources from the Integrity Commissioner?
That's not my understanding at all, Lydia.
Was he allowed to go to the
Nicholas
CCC?
Stepanov to a parliamentary oversight committee?
Sorry?
Did you personally refer?
Let me say the allegations that were raised by the integrity officer yesterday are incorrect.
So was Mr Summerall allowed to go to the CCC? He's saying he wasn't.
Sorry?
Mr Summerall was saying that he went to the CCC directly, but then he was sanctioned by your office, Premier. And I just wanted to know.
Excuse me, that is not correct.
Well,
I reject the premise of that. There is a lot of misinformation going around here, and I reject the premise of your question.
So would you say now that public servants should go directly to the CCC if they haven't?
Well, there's two issues. If there is an issue in their workplace, they should go to their Director General. If there is any allegations of misconduct or corruption, they go to the CCC.
Premier, why was Nicholas Stepanov referred to the parliamentary oversight committee?
I can't say, as some matters are before the CCC.
She says she doesn't know the contents of the complaint. Isn't she entitled to know that?
The matters are with the CCC. I can't comment any further.
Did you personally sign the referral to the parliamentary oversight committee?
Let me say very clearly what she is. I've actually spoken to the Australian in relation to that matter, and the matters that were referred to the committee were not what she alleges. So I have made that very clear. I can't say. There are matters that are currently before the CCC. I'm sorry I can't say, but I have obligations to refer matters under the Act, and I take those matters extremely seriously, and those matters were referred to the committee, and I'm not at liberty because they are matters before the committee.
So you were the one that referred it. Was it something to do with...
I cannot say I have obligations under the Act. I cannot say what that matter was, and there are some matters that are currently before the Triple C.
In reference to Mark Summerall's report, not
Yes.
the one that went to the Triple C, but the one that went to Minister de Brenny, you have repeatedly said that your government prides itself on openness and transparency. Why was that report not made public at the time?
My understanding was the archivist at the time, we're going back here, 2017, I think we're about 5 years ago, everyone, so this is not happening today or yesterday. 5 years ago, I want the public to be aware of this, and the reporting should reflect that this happened 5 years ago. My understanding is that reports were provided to the Triple C. The Triple C sent back some information. The recommendations were then forwarded to the Director General, and I am advised by Minister Enoch that those recommendations, all of those recommendations, have either been completed or underway.
But why was that report not made public, except to the Triple C report that could have been made public?
Well, you have to ask Minister Enoch about that.
Are you disappointed that it wasn't, though? Given that it was
It's 5 years ago, and the Triple C finalised their report. They made some recommendations. Those recommendations have been implemented or underway.
Has your Director General issued the terms of reference for the probe into the...
She'll be doing that tomorrow.
Regarding the seizure of the...
I think I'm advised it might be tomorrow, so you can contact her office.
Regarding the seizure of the Integrity Commissioner's computer, how does this happen in a Western democracy under law watch? Alleged. Some matters are before the Triple C, and I've said at length, well, I'm not commenting any further on that.
Premier, just on that matter, because the Triple C is under investigation itself,
Yes.
and the Year review looked at the functions of the Integrity Commissioner's office, what sort of review or investigation is going on into the Public Service Commission and its alleged role in this?
In relation to what particular?
The seizure,
The alleged, the allegations, they're with the Triple C.
But the Triple C itself is under investigation.
Yeah, well, not all of the Triple C's under investigation. Let's be very clear. The PCCC made particular reference to what happened with the Logan City councillors. So the review is into a recommendation that came out of that inquiry looking at Logan. Let me say this. We need to have absolute confidence in the Triple C. We need the Triple C to be an independent watchdog, not a politicised watchdog, not controlled like it was by the LNP when they were in office, independent. Now, Tony Fitzgerald and Alan Wilson have a big job ahead of them, and their job is to make sure that those checks and balances are happening and to go through those terms of reference, and they've got 6 months to do it, and my government has given them a budget to do that. They are doing that independent of government. Let them do their job.
Premier, what do you make of Mr Summerall? Would you question his character in some of the things...
Look, I'm not going to comment. I appreciate people making, raising issues, and they should raise issues. I have no problems with that. But Mr Somerville, the archivist, has actually left the employment of the government some time ago. He didn't just leave last week or a month ago. My understanding is he left over a year ago.
Why does that matter that he left over a year ago?
Well, if he had issues, he could have raised those issues at the time
He's
when
saying
he
that
left.
Did, Premier. He's saying he did, but your office kept shutting him down
No.
and changing documents and telling him not to do this and to do that. And
Excuse
and
me,
other ministers as
I
well.
reject the premise of your question. My office did not do that. I reject that. So please don't make stuff up. Please don't make things up. Well, quote. Okay, well, quote. What did he say?
Mr Summerall said that he did raise these issues. He raised issues with Minister de Brenny's office. He was told to alter...
No, you said my office. You said my office.
Raised issues that your office, especially when it came to Mr Barbagello's letter, he raised issues about a letter he was told to sign, and your office kept bringing him another letter back to sign it again, and he kept raising issues saying he didn't want to sign this resignation letter. And your office kept bringing a letter back to him. This is the allegation.
I think you've got. I think we're going around in circles, and I think you've got that wrong. I think you need to get your facts correct.
Premier, with all the issues and concerns that
With all due respect, please get your facts correct. Don't just. No, don't just throw things. So a journalist raises an issue, and therefore that issue is fact.
I'm not saying it's fact. I'm putting the question.
Yeah, and that's right. And I said very clearly, my understanding is that these matters were referred to the Triple C. You can ask them the outcome of that investigation. Now, if Tim Mander referred the matters to the Triple C, he may have a letter from the Triple C. You can ask him to release that letter.
Premier, with all the concerns that have been raised over the past week or so, why do you still feel confident that there isn't a culture of fear within the government?
Let me say this. I did not sack 14,000 workers.
Premier, is it
I
really
value, I value,
tell Queensland
I
what
value,
was
can you
bad
please
in
let
the
me
last
finish?
one?
I value every single worker that works in my government. I value every single worker that goes out there every day trying to keep this state safe, dealing with the worst pandemic we've ever had to deal with in our lives. Do you think it's easy to come here every day and talk about people who have lost their lives to this? We are currently going through a peak of this wave at the moment. We've got people dying in residential aged care homes that I'm very concerned about. I've got kids that I need vaccinated before they go back to school. I have done a campaign to get this state and people of this state vaccinated, where we're now at over 93% across the state. The Queenslanders have done an extraordinary job during probably one of the toughest 2 years that they've ever had to face. I've had businesses that have been impacted. I've had families that have been impacted because they couldn't see their loved ones. So don't for a moment think that I don't get up every day and want to do the best for this state. And I'll tell you this, I don't go and sack people. I don't go and sack nurses and doctors and people who work in the public service. I value them. I value them, and I pride myself in valuing them every single day that I have been the Premier of this state. And if people have allegations, there are robust processes in this state that I abide by and I uphold.
You say you value these people, Premier, but what about Mr Summerall, Dr Stephanov, Neil Dooley, who have all come out in the media in the last week saying they were pushed out of government after criticising?
Well, I reject the premise of that question. I really reject that premise. I value the Integrity Commissioner. I value the people who work for me. I absolutely, if the archivist has concerns, all I'm saying is he could have raised these concerns at the time. I understand he did raise some of these issues with the CCC, and people have the right to do that. But at the same time, we have to respect the institutions of our state.
Do you think the CCC investigates too slowly?
Look, that's a matter for hopefully that the Commission of Inquiry can look at. Okay? Yes.
We still haven't hit the 90% double dose mark. What are you trying to do to make sure we do this?
Oh, in the Gold Coast?
Across Queensland?
Oh, across Queensland we're nearly there. So we are nearly there. So I'm urging people to come out and get vaccinated. That booster absolutely works. And can I thank the elderly residents that I've asked during this wave to stay at home and really not stay at home all the time, but limit their activities and going to a lot of places. Look, my father came over last night. He had his mask on. You know, I know this is impacting on people because they're not living their lives that they should. It's very hard on everyone at the moment dealing with this pandemic, but we are getting through this wave. As Dr Gerard said, we've gone through the wave on the Gold Coast. We're coming down. Brisbane and other parts of the southeast are going through it at the moment, and Cairns, and we're going to see other regional centres go through it as well. So, look, everyone, please just get your double dose, get your booster, and please get your children vaccinated as well. And we'll come through this to a much brighter future.
Well, just on that research with Dr Gerard,
Yeah.
how proud of you as the Premier to see that...
Oh, I'm incredibly proud that we have Australian leading research that was commissioned by our Chief Health Officer. And those results today are extraordinary. And when they were presented to National Cabinet and were raised at National Cabinet, they're now going to do it across the nation. That will give us an idea about actually how big this wave of Omicron actually has been.
Are you charging the other states? You'll lend it to them? Or...
Sorry?
Are you charging them or lending
I think they've got the methodology now, so they can use that. But look, thank you very much. I'll let Minister Gray say a few words, and then we have to go and do a tour of this school. And I'm very proud of our commitments and our investment in education for our children's future.
And thank you, Premier, and it's great to be here with the Premier, with Foundation Principal Kate Hucker, and with Member for Gavin and Minister Megan Scanlon, and of course the Health Minister and Chief Health Officer as well. A $50 million investment in a brand new Coomera State Special School, purpose-built facility, state-of-the-art once again, and one of 3 new schools that we're opening up this year. It's wonderful to be here to see this fantastic hall that the students will be able to enjoy. They're back at school school on Monday. I was advised of 126 enrolments, but as Foundation Principal told us, they had 3 enrolments additional to that. So hopefully we'll have 129 walking through on a school built for 168 in the first stage, and the second stage will build the school up to 260. A wonderful facility, specially and purpose-built for those students from P to 12 who require the ability to come here, and it's wonderful to see that. The facilities are state-of-the-art, they are wonderful, and it's great and very proud moment for the Education Minister to be here to once again visit these wonderful facilities. And can I say Everly and Narimba yesterday were just as lovely, and this Kate, let me tell you, is terrific. But the most impressive thing is that their logo is lovely colours, and they've even got earrings to match, and that's the first that I've seen as Minister for Education. So it's wonderful to be here. Can I wish all the students a great day on Monday that are coming back? And 2 things, please, if you're not vaccinated, get vaccinated, and of course if you're not well, please stay at home and get tested. Very sad to hear about the truck with our rapid antigen tests being delivered to schools right throughout the state. We've had great reports coming in about these tests making their way to schools. I hope that hasn't impacted day one. I don't know how big the truck is, but I wish the driver, of course, no harm at all, and hopefully we can get those tests out as soon as possible again. But they're all being delivered, and we'll be rolling out our school plan when school is back on Monday. Thank you. Yes, I just heard before the press conference that City Point has withdrawn its contract. Can I welcome that? I called for that on a number of occasions this week. And can I obviously urge, in the interests of the mental welfare of students, staff, parents and carers, and in the public interest, that they abandon these contracts and that they never resurface again.
Minister, just quickly, there's a case on the Gold Coast, you're probably not aware of it. There's a mother has claimed that her daughter's being bullied, not physically but online and things like that. And the question is that do you think there's enough that's being done to protect kids from non-physical forms of bullying like verbal and cyberbullying in schools?
Well, we have a very robust anti-bullying campaign in schools. Queensland has led actually the Bullying No Way campaign for the whole of the country for many years. We are forever talking about that, you should not be bullied, and that if this is the case, that should happen. What happens outside of school, unfortunately, we have social media, and I feel for that parent and that child. It can be very destructive to the child, and I feel for them, and please take whatever action they need to stop that from happening. The E-Commissioner takes complaints about those kind of social media bullying tactics, but schools have got a very robust anti-bullying campaign in all schools, and I urge all students, be respectful, love your neighbour, and of course make sure that bullying no way.
Yes, it's not a possible, it's a real outbreak. I've been advised of this matter last night and asked my DG to immediately reach out to the Commonwealth, which we did, to ask for urgent intervention. I understand they were grateful for that call because they weren't aware at that level that this was occurring. This is a facility where since the outbreak, and I'm still trying to find out when the outbreak started, but since the start of their outbreak at this facility, they've had 100 residents who have been positive. We are unclear at the moment how many have recovered, but they've had 100. They've had 82 staff that have been positive, and we are very concerned about infection control and staffing numbers. I know there is a private provider on site who is assisting, but we were asked to intervene because the private provider felt like they were not. Their advice to the facility was not being taken up, particularly around those 2 issues about adequate staffing and bringing more staffing on, and also infection control. So I'm glad that the Commonwealth were willing to step in last night and assist. I'll be getting another update today. I understand there was a town hall meeting or a collective meeting with family members who I have no doubt are very concerned. And I'll be watching this very closely to ensure, and if we need to step in to support the safety of those residents, we will. But very concerned with what I became aware of early yesterday evening.
Okay, thank you.
Thanks.